Hi, I'm here in conversation with Dr. Sydney Brinson. I'm Allison Hart. Dr. Sydney Brinson is in the New York office, also licensed in Virginia. And we're here to just kind of talk about her practice. And I'd love to start off by asking you about your work and interest with the young adult population emerging adulthood.
Yeah, it's a great question to kick off with. I think a large part of my interest in working with young adults comes from what my practices look like, from working in college counseling centers to kind of being in the heart of New York City. I'm always really passionate about working with clients who are going through big life transitions. And when I think about emerging adulthood, it is that. It's switching from college to a career, you're making new friends, maybe your dating scene is really kicking off. And so thinking about all of the different facets of life that are changing very quickly, it can be a source of beauty and it can also be a source of stress. And so a big part of my practice is how do we kind of work through life transitions, have someone feel like they're living a life worth living that aligns with their values. And emerging adulthood is certainly that.
Can you talk about how you understand substance use and mental health, specifically with the young adult population, and how you like to
Mhm.
work with it?
And something that I've noticed in my practice is that, especially in like the last decade or so, like mental health is such a conversation, but oftentimes substance use is a bit siloed and not talked about as much. I'm wondering, like, are drugs a way to manage stress? Are there times that you notice an unpleasant emotion and you see substance use being linked to that? And so there's a curiosity around like what role might this play in how you manage your emotions, how you manage difficult moments, and then also, like, what's the function, right? And sometimes it can be that stress management. Other times it's connecting socially with other people. And so there's kind of a range of ways that we can understand it as like a part of a larger picture. And whether we address it or not really depends on what comes up in the conversations.
When they bring that into treatment, it can often feel accusatory or judgmental. And taking
Definitely.
that stance of curiosity is such a welcoming way to bring in something that could feel really difficult to talk about.
Definitely. I think there's so many parts of therapy where shame, when we talk about like the function of emotions, shame often tells us to go inward, to hide. And I think bringing in a space that is curious and non-judgmental, it allows us to actually be just more open with ourselves about what our goals are and how things are going for us. So that's a big part of what I love about therapy is it gives us a space to do things differently.